Hello friends, myself Dr. Debashish Mukherjee. I have worked as a senior research fellow in Central Council for Research in Homeopathy and Central Institute of Psychiatry. Today I am going to discuss about an important medicine, Lycopodium. So let us begin. Lycopodium has many spheres of action. It acts on digestive system, mucous membrane of digestive system, of respiratory system. It acts on lymphatic system. When it acts on digestive system, it lowers the digestion. It lowers the digestive process. When it acts on the lymphatic system, it produces swelling of glands of the neck. When it acts on the kidneys, it produces painful micturition. Now let us begin about the mental symptoms of Lycopodium. Whenever you study a medicine, you should know about the mental symptoms of that particular medicine. And you should be able to study the patient in a very short span of time, how the personality of the patient is. So, Lycopodium patient, first of all, I would like to say the Lycopodium patient is a people pleaser. People pleaser means he wants to please the people. You will find Lycopodium patients in intellectual persons such as professor, engineer, etc. And you will find that person is very polite and he speaks very nicely. And when you go on asking, and you can understand that the particular person is a people pleaser, he will speak in such a way that the persons are pleased with him and he doesn't wants to hurt anybody. And this is because he feels there is a feeling of insecurity. There is a feeling of insecurity that people will abandon him, people will not be close to him. So he wants to maintain a passive attitude. He wants to please the people. Lycopodium patient will behave as if he is very brave, but he is not so. If you go on asking the patient, you will find that there are many symptoms of anxiety. From outside, he will behave that he is very much brave. He can face any situation, but from inside, he is very much fearful, anxious. And all these symptoms, you will know that Lycopodium matches very well in cases of anxiety disorders and other types of, the patient is very much anxious when he goes out undertaking anything new. Whenever he has to undertake anything new, he is very much afraid of appearing in that particular role or playing that particular role. Next is that Lycopodium patients are very much opportunistic. They are very much selfish type of person. They are always they are in search of opportunity in which they are benefited, and they don't care about others. But from outside, you will find that they are very much soft, polite, and you will feel that they are very nice person. But there are many Lycopodium persons who are very much opportunistic. Next, that is very important, is that detachment. The Lycopodium patients are very much detached. They are not emotionally attached with their friends, with their family members. You will find that many Lycopodium patients abandon their wife and children because they don't have any type of attachment to them. They are very much selfish and they always in fond of earning more money and becoming rich, and they always believe in pomp and show, and they are very much opportunistic at the same time. The Lycopodium patients always suffer from gastric problem or gastric problem, digestive problem. You will find they will complain that after taking food, afternoon lunch, their abdomen is bloated and they are having frequent eructations and burning, heartburn, etc. Whenever you find all these symptoms, you try to confirm the mental generals, and if all that matches, then you can prescribe Lycopodium. Next, Lycopodium acts very well in many other systems also. If you know the peculiar and small symptoms, then you can prescribe Lycopodium in case of piles also. Recently, I had a case of piles who in which the patient complains that there was much pain in the anus after passing stool, and there was much swelling in the anus, and it was very much painful to touch. On these particular symptoms, I prescribed Lycopodium, though the mental symptoms of the Lycopodium was also present and the patient was improved in a very short span of time. A Lycopodium patient is very much detached to his children. You will find in the repertory there is a particular rubric, indifference to his children. The Lycopodium patient does not have any attachment to his children, and you will find that he don't want to take any responsibility. The Lycopodium patient is very much avarice. Avarice means he wants to keep wealth, earn and keep wealth. He want to live a lavish life, but he don't want to take any type of responsibility. So I hope I have been able to explain the whole personality of the Lycopodium to you, and I hope it will be very much helpful to the young students understanding Lycopodium. You can go through the books of Philip Bailey, you can go through the books of George Vitalkas. At the same time, you have to read the old classical books of Kent and Burt. Thank you. Thanks for watching. Please do subscribe my channel.